This is Dr. Joseph Baker from the Limber Chiropractic Center, and I want to welcome you to our talk tonight on thyroid health and chiropractic. Now, many of you are probably already, you hear this topic and it's like, I don't have to worry about that. I got no problem with my thyroid, my T3, T4 levels, they are fine, fine, fine. Every time I get my blood work done, they are great. All right. Now, some of you are out there saying the exact opposite. I have just so many problems with my thyroid, balancing it out, getting it stabilized. Oh, I need help. Now, I'm going to tell you, regardless of what camp you're in tonight, you need to hear this information because this is going to speak beyond just the conversation of the thyroid. I mean, listen, let's do a reality check. Your thyroid is like every other gland and organ in your body, and yes, we're going to spotlight it, we're going to talk about it tonight. But I want you to think about this when it comes time to talking about your stomach, or your adrenal glands, your pancreas, your bladder, your kidneys, your liver. This conversation is going to bridge into a conversation about all of those other organs. Now, round about now, you're scratching your head just a little bit. Don't worry. You're going to understand more in just a minute. But I do want to remind you of the 3 things that you're supposed to do when you're watching this video. 1, make sure that you're liking this. The only way for your friends to recognize that there's something there is if you're saying, you know what, there's good information beyond this. I want you to watch this yourself. Number 2 is I want you to record what your takeaway was. If you're not aware of this, when you see responses to this conversation, well, let me tell you, those responses are coming directly from me. Yes, this is part of each and every one of our patients, their care plans in our office. And in turn, because of that, it's important enough for me to put it as part of your care plan. It's important enough for me to respond directly to your questions, your concerns, your comments. So that is me responding directly to what you're reporting in. So leave me a comment, your big takeaway, maybe a question that you had. I want to hear from you. Now, number 3 is to make sure that you're sharing this information. I recognize that, you know what, we all have friends and neighbors, they don't know what we know. And as you listen to this and we spend the next 20 minutes talking about this topic of thyroid and chiropractic, well, you're going to be learning things that, quite honestly, others around you need to know. And the only way that they ever get that information is to have somebody just simply tap them on the shoulder by showing up in their Facebook account with either, you tagging them or just sharing it on your Facebook feed so that they get exposed to it. Now, let me remind you, it costs you absolutely nothing to make sure that we're forwarding the information, and yet we don't know how much it's going to impact somebody else in the moment of them hearing this information. So with that being said, let's dig into this. Because I'm going to tell you, there's many Americans out there that have trouble with their thyroid. They have problems, and they don't even know that chiropractic is capable of helping them in the process of gaining stability. Now, let me tell you, this is one portion of the conversation. Yes, there are other components, and there's a lot of different reasons for people having problems with their thyroid. My grandmother had cancer in her thyroid. And in turn, yes, there were things that needed to be done. There are others that it's based upon things that they put into or onto their bodies. For some, and we're going to be focusing on this, it's going to be because there is a total lack of connection between the thyroid and where the nerve impulses come from in their body that actually tell the thyroid how to function and how much of those hormones it's supposed to be releasing into the system. Now, for some of you, we could stop right there. Just that statement alone. Wait a minute. My nervous system controls my thyroid? The answer is absolutely yes. Embryology 101, that power that made our body, that nervous system of ours, forms the body, it forms the thyroid tissue, it's because your nervous system commanded it to form, and runs the body day in and day out. Well, let me tell you, your thyroid doesn't operate on its own. Your thyroid operates because it is stimulated to perform because the nerves tell it to. And maybe that's your big takeaway from the conversation tonight of, oh my goodness, I need to make sure that my body is wiring and firing correctly so that I'm capable of having my thyroid functioning the way it was intended. Now, if you're not familiar with what the thyroid does, it controls an awful lot of metabolic processes in your body. It's controlled by the sympathetic portion of your nervous system, which means it's on top of everything else. It's not in your control. It's on the automatic side. It's going to be happening. It's going to be running in the background. You don't even have to think about it. It's responsible for maintaining things like the temperature of your body. It's responsible for regulating growth. The feeling of being thirsty also comes from this particular area. There are a ton of different things. And if you ever talk to somebody who has issues with their thyroid, the symptoms that they experience, the things that they talk about, well, they're numerous. And they vary. They're not always the same. They're not consistent over time. So, there's a lot of different warning signs. And like we talk about in the office, if we listen to our body when it speaks to us, we don't have to listen to it when it screams at us. So be mindful, if you're not familiar with, some of the different signals that the body actually gives you in order to help educate you on the fact that there might be something to look at, maybe you need to pause and just simply become aware. Now, there's two types of thyroid issues. One is hypothyroidism, which is when, the body's just not producing enough thyroid endocrine hormones in your system. And then there's the hyperthyroidism. Well, like the name implies, it's producing way too much. Now, let me tell you, either one of these, either above more or less than, is a problem for your body. Your body has a range that it's supposed to operate in, and in turn, if your body is operating outside those ranges, well then guess what? There's going to be issues and problems that do arise because of it. Now, let's get back to the question at hand. Why in the world should I be seeing a chiropractor for my thyroid issue? Well, we sort of started to scrape the surface of this already. And in fact, I'm going to tell you what, for many of you, you're unaware of the fact that, yes, the nerves control the thyroid. Well, your thyroid sits right here between C5 and T1 area, okay? So right at the base of your neck. And the nerves that actually control that particular gland are coming from what's called the cervical ganglion. So it means that there's not one singular nerve that goes there. There's a bunch of different nerves that have all come together, sort of like in a junction box, okay? Just like an electrical system comes together in a junction box, and then there's a few strands that go into the thyroid that controls its function. Now, here's the thing. Let's remember, if we stopped here, we need to talk about what's called the safety pin cycle. In fact, I'm going to tell you, we're going to include a link below so that you can have that information. We've done this conversation on both YouTube and on our Facebook account. You can find the videos there that describe this safety pin. Extremely important. If you're new to chiropractic, if you've never heard the safety pin conversation before, I'm going to encourage you, go watch this. This is how I learned about chiropractic. Because when your brain creates a signal, it sends it down through the spinal cord, goes to the different tissues, like your thyroid, in your body. Your tissue sends a signal back up to your brain, so it knows how much it produced, and your brain sends a signal back down, telling it how much more to produce or to stop producing hormones. Now, here's the thing. We have this reflex going on thousands and thousands of times a day. And as long as this circular response is going, everything works wonderfully. Now, if we have a bone that's out of place, and we have this lack of continuity, we don't have that connection, guess what? Whatever's connected to the other end can't work at 100%. No. Anybody out there want their thyroid not working at 100%? You know, dumping way too much hormone into the system, or maybe not producing enough. And well, let me tell you, nobody is signing up for that. Nobody says, hey, listen, I want a thyroid issue. Listen, very simply, until this connection is restored, that communication process is never going to be the way it's supposed to. So listen, I'm going to encourage you, go listen to that workshop. Go listen to that conversation, because here's the thing. With every organ, with every tissue in our body, it works off of that safety pin. In fact, you know, we've spotlighted just a few of the glands inside the body, and many of us don't realize that all of the tissues, all of the glands, all of those things that we consider under hormonal control or hormone releasing inside of our body, they're all controlled through our nervous system. And in turn, if we lack that level of communication, whether it's too much thyroid, hyperthyroidism, not enough hypothyroidism, maybe we have adrenal fatigue where we just totally lack energy. Maybe the salivary glands aren't working the way that we're supposed to, and we can't digest food the way we're intended. Listen, all of these glands are under the direct control of your nervous system. So, if we have a subluxation, just like you see here, guess what? Our tissue is not going to work properly. Now, listen, we could talk about case studies, and I am not going to bore you with the case studies that are out there and available. You could look those up on your own. But when we see the direct response of being under chiropractic care, having the subluxations removed, and the tissue being able to perform and function the way it's supposed to, amazing things happen. And I recognize that, like anything else, if we are removing the interference that is causing the body not to work at 100%, it boils down to a simple formula. Time, frequency, and simply intensity of work. Now, the time is the fact that, hey, listen, all healing takes time. It's taking your body time in order to get to that place. It takes time in order for it to repair and get back to where it's supposed to. Yes, there is a frequency. You need to remind the body exactly where it's supposed to be and how it's supposed to be functioning. So the repetitiveness or the frequency of engaging and making sure that you're checking the spine. And then finally, the intensity. Because for some of you, when we look at the corrective process that many individuals go through under chiropractic care, it's not just the spinal adjustment, but are you putting the curve back in the neck where it's supposed to be? Do you have that normal 45 to 60 degree curve? Or are you one of those individuals who have lost a curve because of technology? Or because of the car accidents or the slip and falls? See, your body doesn't care. All it knows is that if you're not addressing all of those different issues, well then, there's no way that your body is going to restore as quickly as you want. In fact, for some, you're going to need to make those very difficult decisions of changing lifestyles, reducing the inflammation inside the system in order to lessen the stress on your body, because your body operates as a whole, not as these individual parts. So in turn, I realize when we start looking at these case studies, normally there are numerous things that need to be addressed in order to get the results like these people have. But here's the hope. See, the hope is by us taking action, it eliminates the fear. It also allows for us the opportunity to make sure that we're doing everything within our power to help our body perform the way it's supposed to. Because here's the thing, in the end, your chiropractic care helps get to that root cause of the problem. Removing those subluxations, making sure that that nerve connection is there, making sure that you're producing that proper level of connection, which means that your brain is able to do everything it's supposed to in order to allow the body to heal. And then finally, to improve that overall health in your body. Because the health of our body is directly proportional to the health of our spine and our nervous system. So one of the things I'm going to encourage you to do is to make sure that very first thing of not just getting adjusted, making sure that you're getting checked. You need to make sure that we're making that very first step, which is to actually test the system. If we want to get the power turned back on, well, let me tell you, like any electrician, you're going to go in and they are going to test the system. If we're not testing the system, if we're not slipping and checking, then guess what? How is it that we know what's going on and what needs to be done? The remarkable thing is that for many individuals, well, listen, they're over 50 years of age before they actually experience their very first spinal check. You would never imagine spending the first 50 years of your life not having gone to a dentist. And yet, that's the norm. That's the common time for people to first step into a chiropractic office to simply get checked. But I think you all know what happens next. They're not dealing with a little problem. They're dealing with a big problem or a crisis on their hands. If you've never been checked, I'm going to encourage you. Find a local chiropractic office. Make sure you get your spine checked. If you need a referral in order to make sure that you get to a good and better place, if you're not in the Limerick area, call us. Leave us a message in the comment section so that we can help you get to a better place. We would be more than happy to refer you to different locations that we know are great offices. If more people were doing that and getting the information and knowing how it is their body is functioning, more people would be less dependent on the drugs and medication that are oftentimes used to control the thyroid issue. My hope is that in the end, as we take more accountability, we lessen the likelihood of that ever happening to anybody. If you do have a question about this or any other topic, leave a note for me in the comment section. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.